Welcome to the Healers Café, the #1 show for medical practitioners and holistic healers to have heart-to-heart conversations about their day-to-day lives while sharing their expertise for improving your health and wellness. So welcome to the Healers Café. And today I have with me Dr. Stacey Francis. And she's been treating patients using chiropractic kinesiology, nutrition, and functional medicine in the Metro Detroit area. Now, she's got a vast background on autoimmune disorders, allergies, gut health. Well, we're going to find out more as we speak. And then one passion, which is really to allow the patient or the client to express what's really going on with them on their path to wellness. So I was very excited by that part particularly, but I just want to welcome you to our open discussion.
Thank you so much. It's wonderful to be here.
So let's maybe start. What brought you on this journey yourself, your own path? Because often people associate to that.
Right. Well, started long ago. Like when I was 13, I was called out because someone told me I had a bald spot, and I'm like horrified. And I went running to the bathroom, and I saw my hair was so much thinner, and I didn't realize it. And one doctor after the next, but of course they only fit you, you have to fit into their box to get a diagnosis. And so I had undiagnosed autoimmune disease for a long time because I didn't fit into their box. And so I didn't get the right treatment for a long time. And then when I was in chiropractic school, just graduating, I was so sick. My stomach was hurting. I was fatigued. I was so sick. I got out of chiropractic school and I was driving. I was gripping the wheel. I was at a stoplight and I put my foot on the brake, and I was just so exhausted that I could not even, I just squeezed the steering wheel just to stay awake. And then a child and a young girl, a child and a mother walked across in front of me. And I thought, this is way dangerous. So I delved deep into nutrition and tried to find out about what was going on with myself. I reached out to lots of different resources, lots of different practitioners that were working more holistically, because chiropractic doesn't mean holistic, doesn't mean nutrition. In school, you should see the bad behaviors they do. So chiropractic does not mean healthy across the, it's just what we can do with the nervous system. But then I took it further and learned all about nutrition, and I was able to balance my blood sugar, correct my thyroid, correct anemias, and brought myself to a really great point in health where now I'm teaching people and teaching practitioners and teaching patients and just empowering the people around me. Wrote a book on it just so that I wouldn't have to repeat myself all the time. And it's been a wonderful journey, and I'm just very grateful.
Well, it's interesting that you say, chiropractic, and I'm not picking on them, but chiropractic training isn't holistic. It's a piece of the pie, right? And if you don't put
holistic, it's holistic with an H. It's not holistic. Like
exactly,
you have to choose to do the nutrition. You have to choose to do,
right,
the biochemistry. Like we're taught it, but do you apply it? So that's a choice.
Right. And then you also looking at if you're like in your case, or maybe you could expand on this, receiving, because as a student you would receive treatment, right? I'm assuming it's sort of like my training was as a naturopathic doctor, which I would say is also holistic, but not holistic. So I would agree with you, though we have nutrition, Chinese medicine, homeopathy, we have quite a few things, and naturopathic manipulation, I think is how they're currently calling it. But there's more to the healing process, right, than even the sum total of these parts. It's how do you investigate what is going on, right? And I think that, so if you bring us through a little bit the model of chiropractic, how is it missing the WH pole?
Well, that's a great question. You've got to understand that chiropractic has a lot of different ways in which people can utilize it. And some people will do an activator technique. Some people will do a adjusting technique. Some people do x-rays. Some people don't. Some people just do the upper cervical. So chiropractic itself is really about the nervous system. And so just like any other specialist, they specialize in the nervous system, where all of us are trained to be physicians, to diagnose and to treat. And so when we are diagnosing, a lot of chiropractors choose to refer out for anything that doesn't fit into what they choose to practice. I choose to practice it more holistically. So that means when patients come in, oftentimes I do a really long intake. So they fill out lots of forms, but they also sit with me and we talk, and they get to share everything. And the most common thing I hear is, I'm not being heard. I've told my doctor this so many times. I've had the same symptoms so many times. I'm not being heard, or they're just not sending me to the right places and they've run out of resources. So that's where I come in. So if I don't have the tools, I will find who does, and we will move you forward however we can. But looking at all the systems of the body is very important, and it helps us figure out what's going on, but also do it in a more natural way. We really, as a chiropractor, I don't utilize medication. So I'm not an MD, I'm not a DO, where medication would be added on and sometimes used first, which you and I both know we'd rather not. And the patients that come to us are knowledgeable enough to know they'd rather not. Right. And so we try everything else before resorting to medication. Of course, medication's there for first line therapy, for not first line therapy, but for first aid. And so, of course, we're going to utilize that as necessary. But we're definitely, first line therapy would be food, environment, mental status. And so that's how we begin.
So do you have, I love examples, and I'm just wondering, I'm putting you on the spot, but that's how it is.
No, okay.
A patient that like has gone to a general practitioner that didn't get hurt, and what it is that they were trying to address, and why, and then how they went to a regular chiropractor that was not holistic, tried to address through the so-called nervous system and still missed it, and then ended up with you, like a journey. I don't know, I can think of several examples in my practice where it's like, where I really over the years woke up to this reality, which at first I didn't know existed. So do you have examples like that so people can really see? Yeah, go ahead.
So a patient came in, she had fatigue and brain fog. And when I say brain fog, her head was hitting the desk at 3 p.m. She couldn't focus on her work. She felt like she had cotton balls in her brain, right? She just couldn't keep her eyes on the page and kept rereading the same sentences. Fatigue, she just couldn't keep her eyes open at times. So those two symptoms is what she came in with. And she said, I've been to my medical doctor so many times about this. And we've tried, he's taken my blood work and he says, my thyroid is fine. I don't have iron deficiency. My glucose is fine. I don't fit into what he is prescribing for me. He keeps looking. And the last time I came in, he offered me an antidepressant.
Yeah.
Right?
Yeah.
So at that point, she said, I chose to see a chiropractor, and I've seen quite a few chiropractors. because I was told that since my brain fog has to do with my upper cervical spine, that would help. And it does help temporarily, but it doesn't help long-term. And I'm wondering what else is missing. I was wondering if you could help me. I heard you're more thorough. And so that's where I came in.
Yeah.
So when I came in, the first thing I did was I asked her for her labs that all her other doctors had done. And so we looked at those. And when they said they checked her thyroid, what they meant is they checked TSH with a reflex to T4. Now, if the audience doesn't know this, TSH is a communication from the brain to the thyroid, and it stops there. And if that is out of range, then and only then will they also test the main hormone that the thyroid produces, which is T4. So she had one test, but the cascade for thyroid is very long. And oftentimes you either can't convert from that main hormone T4 to T3, which is the active hormone, or more commonly, especially where I live in the United States, you have an autoimmune reaction to your thyroid, causing your thyroid to be irritated. And so you will display hyper or hypo symptoms. And hyper symptoms would be sweating all the time, rapid heart rate, thinner demeanor, where hypo would be gaining weight around the middle, don't know why, fatigue, dry hair, losing the outer thirds of your eyebrows, like they're getting thinner, cold hands, cold feet, things like that. So you can bounce back and forth if you have this autoimmune to your thyroid, which is actually a GI issue. It's a gut issue. It's not a thyroid issue. And so that's what we investigated on her, because it wasn't even showing up that the tests were even done. And iron, they did iron, but they didn't do ferritin. And ferritin is stored iron. And ferritin is the first marker that will show if you're iron deficient or you are not utilizing your iron properly. And so we look there. And when we look at blood sugar, we don't just look at glucose. We look at hemoglobin A1C, which is an overview of the last 3 months. We look at insulin, because insulin is often high first before glucose, right? We look at all these things. We look at inflammatory markers. And so when she came in, she did have high thyroid peroxidase enzyme, which is an enzyme that we know the immune system is attacking her thyroid. And so then I asked her, what's your diet like? You want to hear what her diet was like?
Okay, go ahead.
Cereal, I know. Hold on to your head. Cereal for breakfast, right? Pasta for lunch. And what did she have for dinner? Like, and she had like chicken, but rolls, always had rolls on the side for dinner. Gluten, every meal. I said, how's your GI system? She's like, I'm always bloated. I don't have stomach aches, but I'm always bloated. I feel like I'm always distended. We identified that she had a gluten sensitivity.
On top.
On top of all that. But that was a game changer for her, just removing gluten. You know, Dr. O'Brien says, if anyone, any human being eats gluten, it causes a transient leaky gut, a temporary leaky gut, no matter who you are. And only 7% would have celiac, but so many more, 80-90% have non-celiac gluten sensitivity. And it's the transient means you have this leaky gut for a minute when you eat gluten, but then you stop and it heals. It heals between the next meal if you have a really healthy GI system. And so you don't have symptoms and you're not considered gluten sensitive.
What would your life be like if you were pain-free? If you were one of the millions who suffer from chronic pain, the thought of just one day without it may seem impossible. This is often because conventional medicine tends to fall short in the treatment of pain, opting to prescribe pills or recommend surgery rather than getting to the root cause of the problem. But if you are suffering with emotional or physical pain, there is hope. Join the founder and CEO of Bowen College, Manon Bolliger, live online for your body-mind reboot. Learn how to listen to your symptoms and get to the root cause of your pain. Plus, be trained in basic Bowen therapy moves so that you can reboot your body for optimal health. You don't have to live in pain. You can heal. Stop the pain pill cycle by visiting www.yourbodymindreboot.com to learn more and to register.
But if you have a harder time recovering, then you're going to have more leaky gut, causing more openness of what's in the GI system getting into the bloodstream, triggering the immune system, which is how this started for her. And so we backtracked and we cleared all that up. We gave her support where we needed to give her support, and she did just fantastic.
Yeah, it's I mean, that's a great example, and I'm not surprised that the first one ends up with antidepressant, because that's been all my cases. What hasn't been able to be figured out, it's basically, rather than saying let's go to other forms of therapies that are out there, other perspectives on health, it's like, let's first assume that you're depressed, right? And
Well,
I find,
at least it will stop them from complaining.
well, exactly, that's, I think, the order. And also it gives them something if they believe in it, you know. And some people, you know, I've had people saying, do you think I am, you know, like, am I deluding myself? Am I you know, it like, the white coat syndrome has a big impact on people, you know. And it's it really can play havoc with their own, you know, innate knowing that that's not the problem, you know. But when you're told
And,
you should take it, you know.
and I agree that there's a place for everything.
Mhm.
And I'm not downplaying the need for antidepressants for the people who feel like they need antidepressants.
Of course.
When that is given because the doctor has ran out of tools,
Yeah.
it's not a healthy thing to do for a patient by giving them something that is hard on their liver, hard on their kidneys, hard on their nervous system, addictive.
Yeah. No, and I do think it's like part of being a doctor, if we stretch the definition to being those that are in practice helping people, right? I mean, it would be really good to know what other modalities or other therapists do before, you know, choosing that route, right? I've often thought that that should be our obligation, and including those that are in what they call alternative or complementary. We really need to know when is it time and when is it a good idea, you know, to refer to a chiropractor or to refer to, you know, even like a physiotherapist. They do their thing, but not at all times, right? Sometimes you need to do other things before that. You're not just rehabilitating, right? So it's like a real understanding of what's available, and where it comes in to help. I've often had this vision that I'd write that one, you know. It'd be like everyone has to read the, you know, all the disciplines and what they are, so that at least we have and the patients too, they have to know, and then be able to ask those kinds of questions, you know. Where do you think I should start? You know, I think
And
it'd be
that's
a
why I do
world.
appreciate social media, because it does give people some education of what else is out there.
Yes, it's true. It's true.
So it's
Yeah. And
helpful in that regard.
how they look at the body and the person. Yeah. Yeah, very interesting. Okay, so your focus, you said, is on nutrition at this point. I mean, nervous system, as far as how do they intertwine? How do you, like, would you have ended up, or did you do chiropractics with, for example, this last person you mentioned?
Yeah. So you've got to understand that the nerve supply goes everywhere to all your glands, all your organs. For them to be healthy, you need the nerve supply getting there adequately. And as a chiropractor, and specifically a kinesiologist is what I do, is
Right.
I identify weak muscles and I use muscle testing to determine imbalances in the structural system. And so when I muscle test, I will first do just an overall muscle test. So I'll test your legs in different avenues so that I can see this muscle versus this muscle versus this muscle, which one's strong, which one's weak. If I find a group of weak muscles, I will trace the nerve supply back to the spinal cord, look for rotations or compressions in the spinal column, and correct those using a chiropractic adjustment. And as soon as that adjustment has taken place, I can go back to that weak muscle and suddenly it is strong because now the nerve supply is getting to where it needs to go and we're able to move forward. We know it's getting to where it needs to go. So if you have any sinus issues, we're going to look in the upper neck. If you're having lung issues, we're going to look in the mid-thoracic. If you have any GI issues, we're going to look in the lumbar spine. But I look at everything every time to evaluate what is strong, what is weak, where the nerve supply is going, where it's not going, get it there. So we know they're getting everything you need for that organ system, plus nutrition as well.
And how impactful, let's go back to depression, which in this case, this particular patient did not have, but some do, or they have anxiety or that type of mental, emotional situation. How impactful do you think that is, or that you've seen in your practice on your structure?
So it's extremely, but the way I practice, I never separate them. Now I always do both. So I'm not going to tell you I did an adjustment and they were no longer depressed because I don't stop just with that. But when you have the nerve supply getting to where it needs to go, your sympathetic nervous system can calm down. You can get back into parasympathetic. You can get back into rest and digest from fight or flight. You can calm down your nervous system to the point where you can start functioning better. Your vagus nerve works better. Your GI system works better. And where you create serotonin, you can create the neurotransmitters you need to feed your brain so that you have mood modulation.
Right. So you'll be able to address that with the structure, but then you keep going holistically, right? Basically, it's not like.
So if their GI system is off because they don't have the right probiotics or any probiotics because they only eat white food, then we're going to supplement them with something that's going to help that. If they don't get enough fiber, we're going to talk about increasing fiber-rich foods. We're going to talk about not having sugar and having, a lot of bacteria and yeast that's growing in their gut. That's going to affect their brain, right? It's going to affect mood. Anything that affects the brain is going to affect mood. And sometimes it's not depression. Sometimes it's anger. Sometimes it's frustration, irritability. Like that gets more undiagnosed than depression.
Right. Yeah, it might be also more obvious on some level.
But they chalk that off more to a personality trait
exactly
than a disease process. And so it doesn't get treated.
Yeah, that's true. So you have a food, what is it, a food guide, or what is your, tell us a little.
So we didn't talk much about this, but oftentimes fatigue comes from a blood sugar imbalance. And so in my book, The Supercharged Method, which this is what it looks like, you can find it on Amazon. It tells you how to eat to balance your blood sugar. But I'm going to give you a quick trick. Okay, it's 1 serving of protein, 2 servings of above the ground veggies, things you'd put in your salad. Every 3 to 4 hours, in a 12-hour time period. And we can talk all about why that is, but I gave you a meal plan so you can put things together and create 1 serving of protein, 2 servings of vegetables every 3 to 4 hours in a 12-hour time period to help you balance your blood sugar in order to help you with your energy balance.
Mm-hmm. And the fat in that is from the protein, or are you adding olive oil?
So you're starting with the protein and 2 veggies. You'll
Yeah.
see on the card, you're going to have that. That's your base. You got to have the minimum of that,
Yeah.
because fats are often in proteins. Your chicken, your fish, your salmon, you're
Yeah.
going to have some fats in there. So I'm not overly worried about that. But you'll see on the worksheet that you're going to that meal, not on its own, you can add up to 2 fruit a day. You can add up to 2 heavier vegetables like potatoes or rice or grains a day. And you can add more healthy fats, olive oil, olives, nuts, seeds, tahini, olive oil, avocados, right? All the great fats, but no industrial oils, no refined sugar, no processed foods. That's how we do it.
Mm-hmm. And do you mix like the vegetables under the ground? Are they
Those, the under the ground are the ones that you add to the meal, but you can't count that. You got to count the
as
2
part of?
vegetables. That's not right. That's
Okay,
an
okay.
addition too.
Okay, yeah. Good. Yeah, because there's some theories that you should eat them alone and not with meat, and I've heard so many different ones.
Right. And so the reason I did this particular
Mhm.
way is because I needed it to be super easy and
Simple.
flexible. It's
Yeah.
the first step for most people. Once
Yeah.
they get down a very good eating habit that doesn't include processed foods, that doesn't
Mhm.
include sugar, they're not having a candy bar on its own.
Yeah.
We do it in steps in the book. Like if you're a fast food eater, we'll take you there and we'll talk about what to eat there before we like baby steps. But once you've established a really good program and it hasn't gotten you right where you need to be, that's where you employ other strategies such
Right.
as
Yeah,
isolating.
see what's missing and isolating. Exactly. Yeah, that makes sense. I'm smiling because I'm actually on a holiday in Mexico, and I was thinking the birds, when you say not to eat any of the processed foods and all that stuff, but I'm looking at them, they still have these containers of sugars, some of them so-called for diabetics, that come in pink, and then there's the yellow ones and the blue ones,
Yeah.
and then the white sugar that's also fully processed, right? But you've got these birds coming, and they take the package, and then they break it open. They will not touch any of the colored packages at all.
You're so smart.
I know, they're so
I wish
smart.
we were that smart.
Though they do the other sugar, but just see how they do that. It's like, they take it, you think they're going to eat the whole thing. No. They're actually finding a place, and they will not touch the others. So
Oh, wow.
I thought I should add that. Great. Well, okay. So, our time's like almost, it is up actually. So where again we'll put a link, of course, in the description, but where do people find this, download, or this
Okay,
beginning?
so the link you'll find, because
Yes.
you're going to share that. But if you'd like to work with me, I'm happy to work with you. And you can find me at specificwellness.com. And of course, you'll share that as well. And
Sure.
just reach out. I'd love to work with you on whatever health issues you're struggling with, and I'll help you get to your goals.
All right. Okay. And you're situated where again?
I'm in Metro Detroit, Michigan.
Okay. So I suppose because of the chiropractic and kinesiology, it's in person.
Well, that part would be in person. I do functional medicine, not in person. I do that.
Right. Okay. Yeah. Well, at least it's a start for sure, and then it can all be built in.
And oftentimes, like if I feel like if you don't already have a chiropractor and you want that support, you need that support, I can help you find someone similar to what I do.
Right, locally. Okay, well, thank you so much.
Thank you
Dr.
so much.
All right.
Have a wonderful day.
Thank you for joining us at the Healers Café. If you haven't already done so, please like, comment, and subscribe with notifications on, as I post a new podcast every Wednesday with tons of useful information and tips for natural healing that you won't want to miss.